Yeah, so clicking doesn't always indicate that there's instability, right? You know, there's other things that can click. It could be reduction of space, it could be impingement sign, it can be grinding, it could be cartilaginous issues, there could be enough irritation or inflammation in the joint that there's less space right now. So there's a lot of different directions, and that's why we have to do multiple tests, maybe even sometimes multiple times, and take a good history of like what the heck happened to that person. What if they dove for a ball, slightly dislocated it, and then they hit again, like they dove like that, and it dislocated mildly, and then relocated on the spot, and then they just feel some shoulder pain. They don't really know what's going on. You know, this is why it's important to ask the patient or the individual what sport you're doing, why you're doing what you're doing, what have you noticed, what can't you do, what can you do, what do you feel. Like, it's important to take time with each client or patient versus just saying, oh, well, I think there's a shoulder issue, let's just crack it. I think that's important, because if you're starting to take an unstable joint or unstable shoulder and you start to crack it, like, you're creating more movement into an area that has too much movement. Another thing that we'll see, and sometimes some laxity of the shoulder, a very simple test that you can do is just axial distraction, which means you're just going to relax your arm and you just pull down, right? And you'll pull a little bit this direction. So I want you to stay nice and tall. I may even stabilize up here, like at the top of the AC joint here, and I'll pull a little bit this way, and I'll just do this. And what we're looking for is a sulcus sign. You had a little bit of pop in there, and that's okay. We should feel a little distraction of that joint, but we shouldn't see a big giant sulcus, meaning like a little step defect. So imagine like what you're going to do is have a step here and then a step here. You'd see that obviously drop. You don't want to see that drop right there. So this is a sulcus sign that you're looking for. You should not have that, and you do not. So we can say that in this case, the stability up here is okay. So the superior labrum should be okay in this direction. A lot of times people will do anterior posterior drawer testing, which is what we're going to do on our back. But sometimes you can just do it here. You grab the AC joint and you kind of just go. Now, I have relatively smaller hands. You're a relatively larger guy, so maybe I cannot get around your shoulder that easily. And I might stabilize and just go posterior drawer just to see what you can tolerate. If you can't tolerate that, you're not going to be able to tolerate the other one. So let's go into your back. Your head will go here. And so what I will do is I will come in this direction, and just so I can show the camera a little bit better, I'll grab here and I'll grab at the top going this direction. I don't want to grab down low. I want to grab at the top so I have more authority, and I can come up and down. So I'll be in this position here, and just you have to relax the best you can, and I'll go up. So I'm going upwards and a slightly medial, and then I'm going posterior and slightly lateral. And so I'm seeing to see if there's too much movement of that joint going this direction. And in your case, you're fine, so you passed those two tests. If I had to say it based off of those 2 or 3 tests, you're probably not having instability, right? And of course, apprehension sign can be done seated. And a lot of people who have recent dislocations won't even want to hold that direction. In a client or patient setting, I will be very cautious of this. Like, are you okay? Or what I'll do is at the beginning of the testing, I'll have you sit down and I'll have you do it on your own. Can you do this? And so, like, because if they can't do this, they'll be like this. They'll be like, yeah, I can do it. Or no, they're like, yeah, I feel like if I go this way, it'll click. So it'll slip out. So if they can't do this on their own, I'm not going to try. But you can add a little bit of extra pressure to see how they're feeling. You can see what the capsule looks like in that position. And then you could do that resisted position from here, because this is a very vulnerable position for the shoulder, and you can give just a little bit of resistance right there, and you give a little bit of that stress to that bicep and to that capsule and to the joint complex there, and then you can kind of you go through here. So just a little bit of that resistance. You could do it seated, you could do it laying down, in every direction. So now you have Come on up. So now you have a bunch of different stability tests. So basically, if we run through them very quickly, we can literally just go like, can you do this? And you go, I can do it. All right, good, great. Maybe a little bit of over pressure. Like most people won't even be able to do that if they have a dislocation. Give me a little push down, just gently. Good, that okay there? Great. You know, I'll go like this. All right, that's fine. I mean, and of course I can do that in this direction, and then I do it there. So we've just done, and that doesn't include any other bicep testing and stuff like that, where we do the Jurgensen's or the bicep testing. You know, we're gonna push up, pull again, pull again, pull again, now push up at the same time. Like, that doesn't even include any of the other stuff right there. So right now we just screened out like 5 different tests in 30 seconds. So now you have a lot of information on just the shoulder right there. So now I know your bicep is strong at multiple angles, because you don't just, like, if you do curls, right, you don't just do a curl right here. You can do a curl here, you can do a curl here, you can do a curl. So you can test the medial or the short head, the lateral or the long head. Then you can test it at different angles. You can start playing around, like, okay, so now you have an idea of, like, is the bicep okay? Is there some stability within the shoulder joint? And now you can start playing around with that. And, like, now you have a good idea, like, okay, I could probably do more advanced testing on this person, or I could see their strength without risk of it flopping out or having a very sloppy movement. That doesn't mean there isn't a partial dislocation. It just means, or partial instability. It just means, you know, you have a little more confidence right now.
Yeah.
If you did have that stuff all positive, I would probably be like, hey, I think you're having maybe some instability. I just want to let you know we're going to go a little lighter with certain tests. And you can always go harder. If you go too hard, you hurt somebody.
Yeah.